Hi there, I'm Carolyn, trichologist at Absolique Hair Health Clinic. We're going to bring you a series of some of our results. So they're varied and interesting. The one today we're going to talk about was post hair transplants, and we also used PRP. So this is a really interesting story, and we got fantastic results. The client actually contacted me only interested in PRP, but when we had a discussion, we found that he'd had the hair transplants 8 years ago, which worked, and they were successful and they were fantastic. And then he followed the transplants with a series of PRP. But over the last 5 years, he'd done no treatment at all. Life had gotten really busy. And what he realized is the hair trans was still there and in place and growing really well, but the surrounding hair around it was actually thinning and miniaturizing and going back to what it was before the hair transplants. So when we transplant hair, this is particularly for male pattern thinning, from the donor site into the area where we get male pattern thinning, the hair transplants will remain growing and be okay. But the surrounding hair has no protection against the DHT. So you really need to be aware of doing some maintenance treatment to keep the surrounding hair around the transplants. So what we found is we checked the donor site of the transplants, so the actual site, and that had broken down now as well. So overall, his hair cell and hair cycle weren't functioning well as having the pattern thinning happening around the hair transplants. So further conversation found out he was an otherwise healthy person, he was a business owner, had some stress, but one of the main things we found is he had very low vitamin D. Now vitamin D in our body is a hormone, and you need that to help to protect against pattern thinning, as well as he had hereditary factors. So again, if you're going in for the hair transplants, you really need to put some protective factors back into place. So we looked at the whole picture and we realized we needed to work on the hair cell, the hair cycle. We needed to do some protection against DHT blocking, and we also wanted to really go after results. So we put in our topical treatment, we did some nutritional for what we call cellular correction to make sure the cell could function at its most, and then on top of that we did some PRP. So the treatment was followed for 4 months, because that's the time frame to get changes at a cellular level to grow, and we could see there were significant changes visually, but microscopically it showed there was so much more hair to come. So we then devised a maintenance program based on what we liked and didn't like, what was easy to maintain. We haven't checked in since this, and we're excited to see how things progress over the next 4, 6 and 12 months. So I guess bottom line, if you're going in for hair transplants, check your donor site is functioning properly first. If you do go for the hair transplants, you only need them if you cannot regrow hair. So check in with a microscope first. And if you then do proceed to the hair transplants, you've got to do things to prevent, if it's pattern thinning, from creeping back in, and that's for males and females as well. So as always, if you'd like my help or you want to have some information on how we can help pre and post hair transplants, the PRP types of services and the other topical treatments, we can help you anywhere in the world. So drop me an email, it's info@absolique.com.au.